Welcome, welcome, welcome. Welcome back to I Can't with Dr. T. It has been a minute since the last time we released a new episode. There's a lot that's been going on in the world around us, and there's been lots of other things on our plate. But we're so excited, so happy to be back with you for another episode. You are going to thoroughly enjoy today's guest. So, our first guest for season 3 of the I Can't podcast with Dr. T. I think you're going to enjoy this guest. We're going to touch on a few different topics to launch, again, our season 3 and to celebrate and give some attention to Mental Health Awareness Month. We are almost at the end of May, but we wanted to make sure to touch on some important topics for those of you who are giving attention to and valuing your mental health during May. And perhaps maybe there are some things that you need to do to give additional attention to your mental health this month that you haven't been doing. And so we may have some tips that are useful for you, things that you can do to take care of yourself and your mental health overall. So our guest for today is Aaliyah. And, there's a special place in my heart for Aaliyah because she is one of the LMFT associates that I supervise. I met Aaliyah about a year or so ago when she was searching for a supervisor. And hopefully we'll have some time to talk a little bit about that process and what it's like to search for a supervisor, find a supervisor that is a good fit. Aaliyah is a licensed marriage and family therapist associate here in the state of Texas. You're going to learn a little bit about her, the work that she does, the training that she's had, some of her interests, both professional and personal, some of her relationship tips, and whatever else comes up during the course of our conversation. So please help me welcome our guest, Aaliyah, to the I Can't podcast.
Hello, hello. Thank you so much for having me.
Welcome, Aaliyah. We're so excited to have you. So I mentioned to everyone that you and I met as a part of your process of looking for an LMFT supervisor. So of course, we've got to talk a little bit about what your recommendations are for other LMFT associates or even LPC associates or other mental health clinicians in training who are in that process of finding a clinical supervisor, someone that they can work with and learn from. But before we talk specifically about supervisors, what advice would you give those who are in clinical training who are looking for a good placement, whether they're interns or associates? How do you determine a good place to work, a good place to get experience, considering that there are many placements that don't pay and some that do, depending on where you are in the process? What are some of the things that now, based on where you are in this process, things that you would say you've learned that you would recommend for others who are trying to find a really good place to get experience?
Thank you so much for posing that question. So, one of the things that I definitely think is really, really important that I know now, that maybe I didn't know at the beginning of my journey, was the importance of really, really interviewing the placement just as much as they are interviewing us. So I know for me, interviews can be very anxiety provoking. There are a lot of aspects that make me nervous. And so it can be easy to want to just appear to be a good candidate to the person that's interviewing you. But I think it's just as important for you to be able to interview the other person or the job placement that you're potentially seeking out. So one of the things for me that's really important, because I am the LMFT associate, is making sure that they have adequate opportunities for me to get those relational hours. So for me, that's really pertinent to my license. So that means opportunities for families, opportunities for couples, and if they don't have one or the other, being able to ask them, okay, so is that an opportunity that you offer? You know, what is a realistic estimate of how many hours I can expect to get in that component? That's really important. And it could seem obvious, but sometimes again, when you're in the process of wanting to appear to be a good candidate, sometimes you're more so focusing on why they might like you, as opposed to you being able to really figure out, you know, why do you really like them? So that part is important. Also, really kind of asking questions about the work environment. So, you know, you know, the person that you're, you know, interviewing or that's interviewing you, you know, what is your leadership style? What is the office environment like? You know, what does a day in the life of this position look like? So, you know, if it's an 8 to 5 position, okay, so what does the itinerary look like of that day to day? What you know, again, what are the leadership styles, you know, to figure out, okay, is this from person that's maybe, I think it's called a laissez-faire, so like more hands off, or is it more of a team approach? You know, are there weekly
Right.
meetings? Are there, you know, what does that kind of look like? And being able to ask those specific questions. Um, One of the questions that I've also been asking now as you know, a person that's interested in different positions are, you know, what does the demographic look like? What does the demographic look like of the staff as well as the clientele that you serve? Being a minority, a double minority, a female as well as an African American, that's important to me. So does this company value diversity? Does this company value you know, diversity in the staff? Or, you know, what does that look like? What are their perspective on that? And then also the clientele. So is that something, but if that's something that's important to you, being able to serve
Right.
certain populations, being able to figure out, is that congruent to what it is that you want? And then just realistically being able to kind of figure out what it is that you want, maybe asking, what does a caseload look like? That is also important. Just so that you're not being overworked, but then also making sure that this site is going to provide me the adequate number of hours that I need in order to obtain licensure. It's full licensure, especially if
Right.
you maybe have like, you know, a certain time frame that you're looking to become fully licensed within, then being able to assess, is this site going to help me reach that goal? And then just really being transparent about those kinds of conversations. Because one of the things I'm also learning, being an LMFT associate, our field is not as prominent as maybe some of the LPC or the licensed social workers. And so sometimes people don't really know, you know, the nuances of your license. So it's important for you to know those nuances. That way you can ask the appropriate questions and get the appropriate answers to the questions that you have that you want. So I think those are just, you know, some tips that I've learned, is being able to, again, make sure that you're really interviewing the place that you're trying to work just as much as they are interviewing you. Again, just so that way you have realistic expectations going into it. Now, unfortunately, that doesn't necessarily guarantee, just because you ask the questions doesn't necessarily mean that they're going to be honest. It doesn't mean that, you know, your expectations and your reality are going to be 100% congruent. But, you know, if you don't ask, then you definitely have more of a likelihood of not getting the answers that you want. So it's just important to, you know, just be proactive in the things that you have a hand in, because you can only control the things that you can control. So
I would agree. I would agree. Well, thank you for that. What a great introduction or hop into our questions for today, because you touched on so much, right? That for new associates, often there can be that anxiety about, you know, finding a placement and, you know, I'm just now learning how to be a therapist and maybe I don't know enough. And so I think a lot of people can go into the process feeling like they don't deserve to ask
yeah,
questions or to expect
yeah,
things out of the site. So I'm glad you said that it is important, even as an associate, right, to put forward what it is that you're looking for, what are your needs, what are the types of experiences that you want to make sure to get, or the skills that you want to build. And asking questions about those things. What is the likelihood that I'm going to get this from your particular site? And as well, as it relates to diversity or whatever your specific values are, right? Trying to see if that site lines up with the values that you have, not just clinically, but also personally, right? What are the things that you value, and does that site line up with that? So, great tips for new associates on what to look for, how to enter into that process, because it can be very stressful. We know it's very stressful, and it can be a very time intensive process. So I think those are some valuable
Absolutely.
tips. So, kind of along those same lines, then, what advice would you give prospective or new associates on finding a good supervisor? What are some things that folks should consider specifically when it relates to finding a supervisor that is a good fit?
So I would definitely say, some of the same things that are important in finding a site, I think are just as important in pursuing and finding a supervisor. One of the things that was really important for me is that I guess kind of knowing myself helped me to find a supervisor that was a good fit. What do I mean by that? So I know for me, some of my tendencies are to maybe second guess myself or to doubt. I may know the answer, but I may doubt that I really do know the answer. And so, because of that, I wanted someone that was going to be able to healthily challenge me. So, maybe not give me as much, or I guess not give me the answer, but to help reassure and guide me that I knew what the right answer was. So, that was important for me. But again, that's because a nuance about myself personally that I felt was important. One of the things that was also important, just based on my experience with supervision in graduate school, I really wanted a clinician that looked like me. That was really, really important. I'm sorry, a supervisor that looked like me. And so but that wasn't necessarily a non-negotiable, but that was something that was important to me. So I did interview people that weren't necessarily African American, but I also wanted to make sure that if you weren't African American, you knew how to adequately support me being African American. So, what is your comfort level with having certain conversations that may be some of the therapist issues that would come up for me? Would
Right,
you feel comfortable having those conversations if you weren't African American? Or, what is your openness to diversity? What is your understanding of maybe some of the issues that African Americans are experiencing? So again, if you weren't African American, what is your comfort level with having some of those stuff with the therapist issues that may come up for me because I am African American? So that was important. Also, sort of researching and finding out, is that person comfortable with some of the modalities that I'm comfortable with? So, like for me, emotionally focused therapy is one of the theories that I utilize, and also CBT, trauma focused CBT. So, is my supervisor, is this person, are they familiar with those modalities? The
right,
populations that I was interested in working in, are they familiar with those populations? Do they have experience in those? Working with those populations? I think those are important questions to ask. And then also just, I don't know how to say it besides like chemistry, I guess, but just like, do you get along with this person? Are your
right,
personalities compatible? I think you and I, we have similar temperaments, we have similar thought processes, we have similar personalities. So it worked, it fit. I remember when you interviewed me, I think one of the questions you asked was like, who is your favorite, I think, artist? And I was like, Joe. And you were like, oh, I like Joe too. And of course, that doesn't really have anything to do with supervision or, therapy, but it was like those little pieces that was like that supervisee chemistry that I talked about that is important, making sure that, again, the temperaments, personalities, the way in which you approach the world, you see certain things, making sure that those things are congruent. Because again, if you don't really get along with that person, it's going to hinder your ability to be vulnerable with them, to be honest about, you
right.
know, some of the stuff with the therapist issues that are going to impact the work that you do with clients. So I would say, again, the modalities, the populations, um, making sure that those are congruent, making sure that if there's any sort of things that you know about yourself, making sure that that person is going to be a good fit for you. And then also that chemistry aspect. I think that that's important as well in trying to find a supervisor. Um, yeah.
Yeah, yeah, yeah. I would totally agree with all those. I think definitely it's important to know a little bit about yourself, right? Going into that search process so that you can advocate for yourself. Like you said, ask for what it is that you need, know what type of supervisor might be a good fit for you. And I think even knowing that balance, right? Because um, it is important to have a supervisor that you're comfortable with, whatever that means for you, whatever that looks like for you. But I think it's also important that you're not too comfortable in
Yeah.
supervision, right? That there is um, that as a part of that relationship, there are opportunities to challenge and sort of
Yeah.
motivate that growth in areas
Yeah.
where growth needs to happen. Or, if you're discussing a client issue and there's some counter transference stuff coming up
Right.
for for that person to be able to highlight, hey, let's talk about this, right?
Yeah.
As well, I feel like, supervision is so stressful just all by itself. So that comfort overall is important. But also it's not just about you being a therapist in the room with your client, but you as a person, right?
Yeah.
You leave your site, you leave work, you go home, you have life. And so
Yeah.
it's important to be able to connect on those things as well, because you want to be a well-rounded person, because that's going to make you a better therapist.
Yeah.
And I know there are some supervisors who, at least when I was coming up, like that was some supervisors' model was like, it's just about the clinical stuff. And I think we've moved to just overall in the field to a better place with considering the self as therapist issues and who are you outside of the therapy room. And so as associates, I think, you have to know a little bit about what those needs are too, and assess for yourself whether your possible supervisors are able to address and connect with you in those areas.
Absolutely. I definitely agree with you about the like healthy tension between comfortable but still able to be challenged and also willing to receive that challenge or to receive any maybe you and your supervisor do disagree, but being able to receive, okay, well, maybe they might be right, or they may see something differently than what I see. I think that is definitely important, and I think that our relationship is a good mirror of that I
Yeah,
do feel comfortable, but there are times where you do challenge me, or there are times where you're like, well, what about this, or I'm noticing this, like let's talk about this, or let's kind of dive into that. I think that that's just as important. That way you can actually grow. And I think
right.
that for me, that was something that I wanted. I wanted someone that was going to be knowledgeable, that was going to be able to teach me, but also help me grow. And then also, again, reaffirm that, okay, you do know what you're doing. Like, don't second guess yourself. Like this, you're on the right track. So kind of
Yeah.
be able to have that well-roundedness of, I guess, under the umbrella of growth, if that makes sense.
Yeah, yeah. And I can definitely say that one of the things that I'm impressed by as well that was a growth area for me, particularly when during my master's programs, was um, disagreeing with my supervisor, right? And so I love the fact that for me, it's important for my interns or my associates, the people I supervise, to feel comfortable with disagreeing with me, right? And offering their own pushback, or, offering an alternate view, or saying, well, I don't think you understood me totally. Let me clarify. Because that is so important to the process, right? To be able to develop that voice, to be able to have that level of assertiveness. And supervision is a great place to practice that and build some of those skills. So for me, that's really important that I work with supervisees who are comfortable enough that they feel okay doing those sorts of things when the situation calls for it.
Absolutely.
So quickly, I know recently I had asked you to do a favor and to do a little study session with some of the other supervisees that I currently have. And so just quickly, if you had like top 3 tips for uh, passing the licensing exam, or things that you learned going through the process to study and prepare for the licensing exam, again, looking back, what advice would you give those who are preparing to take the licensing exam?
Okay. So top three really quick things I would say. One is definitely take practice exams. That's really, really important because the exam is structured in a way that there are lots of questions, but the questions are paragraph formatted. So it may be 3 paragraphs of text and there's just one question to follow it. So the timing and the pacing is really, really important. And that was actually one thing that I struggled with a little bit during the exam is my timing was a little bit behind. And so once I realized it, I had to play catch up, and that was a very stressful experience. Thank the Lord I still passed the exam the first time, but that was very stressful. And I did practice exams, but I didn't do it in the time allotted for. So I would just be going through the questions,
Okay.
reading the paragraphs, going through the questions, thinking through the process. But I failed to factor in that time component. That is extremely important because it's a lot. I don't want to mislead you, but it's a lot of questions, a lot of text. And again, sometimes it's 3 paragraphs just for one question. And so if you're spending too much time reading the question or spending too much time reasoning, you can look up and not be going through all of the questions. So that's one, definitely do the practice exams with the appropriate time allotted for the exam.
Okay.
Secondly, it's
Oh,
very,
before you go to number two, let me say this just so I won't forget. But you mentioned, yeah, I passed the first time, kind of like that wasn't a big deal. But honestly, that is a big deal to pass the licensing exam on the first try because there are so many people who have to take the exam multiple times before they pass. So kudos to you for passing on your first try because it gets expensive if you have to keep
yeah.
prepping and testing and yeah, so congrats on that. I just want to emphasize for folks who are preparing for the process that, passing it on the first try is a big deal. So, all right.
Yeah.
So, number two.
I also, just to that point, I also don't want, if anyone is hearing this and they haven't passed it on the first time, I also don't want you to be discouraged that just because you may not have passed it doesn't make you a failure. It doesn't mean that you're not adequate. It doesn't mean that you don't know what you're doing. You being a therapist is already inside of you. Passing the test is just a checkbox along the process. But don't be discouraged. Continue to still study. Continue to practice, and don't give up.
Yeah.
You've already been. You are already a therapist. That test does not define you being a therapist. It's just simply a checkbox along the way. So I did just want to add that piece to it
Yeah.
as
It's
well.
just a necessary hurdle, at least for now it is.
Right, right. But you were being a therapist is who you are. It's already a part of you. You just gotta pass the test, but it doesn't determine your destiny either
Or your
way.
worth, right?
Right,
Yeah.
absolutely. So secondly, I would say it's really important to think of the exam from like an application base. That is so, so important. So there's not going to be questions about vocabulary. It's not going to be questions about, what is this step in this model? Those questions are not going to be on the test. It's very application based, which kind of brings me to my third point of it's important for you to really understand the models. That is really, really important because there are going to be questions that ask you things like, okay, so using solution focused, how would you approach this particular problem, or what intervention would you do in the session with the client, or based on structural family therapy, how would you view this symptom? So it's really important that you really have a firm grasp on the models, understand like how they think, how the clinicians think that are using those particular models,
Gotcha.
what is their thought process, not necessarily what the model that you use or the ones that you gravitate towards, but really understanding the models, understanding maybe some of the origins can help you understand the thought process that you should have as you're utilizing those models. That's going to be very, very important. The only content based that were like really straightforward questions are DSM related. But other than that, all of the other questions are going to be very specific, and it may even have you compare and contrast the models. So it's going to be very important for you to understand, what the models, how they conceptualize certain issues, how they view certain problems. That's going to be very, very important. And the test is very application based. So it's
Okay.
not necessarily as important to understand the content, but the why behind it, or, instances, when do you do this, and why do you do what it is?
Right. Okay, awesome. Well, those are some great tips. And I'll add in there, since we're talking about those testing tips and we mentioned the piece about retesting. One of the tips that I give everyone who's having to retest on a standardized test, particularly like the licensing exam, is to not bog yourself down restudying everything, but instead, and at least for like the NCE, for example, when you test or even when you take the practice questions, a lot of times they'll uh, lay out for you which sub areas you did well on or which ones you didn't do so well on. And so go back through that feedback and focus on studying the areas that you're weakest in. If you're already strong on a particular subtopic, you're already strong on that, right? You don't need to overstudy that part. You need to spend your time beefing up the areas where you're weakest so that you can pull that lower, right, that lower range up on your score. So it can save you a lot of time and help you to see that, hey, there are some areas that I'm strong in already, right? And sort of use that as your foundation. How can I use the areas where I'm already strong to build up these other areas that are pulling my score down? So it is possible to pass, right? These licensing
Yes.
exams, they are stressful, but it is possible to pass. And it's like it's a necessary hurdle at this point.
Yeah. I guess there is one other thing, if I could just
Yeah,
add.
go ahead.
The only other thing I would say is, I know it could feel counterproductive or counterintuitive, but I would just really encourage you, like the day before, don't study. The day before the exam, like just relax, especially if you've been studying over a period of time. If you've been really being diligent, just give yourself the grace and just try to relax. I know it's very anxiety provoking, and it's a lot. I know for me, like that last week before the exam, I didn't really sleep that great.
Mm,
But it did come to a point where I was just like, you know what? I've been studying. I'm going to trust the process.
right.
I know this information. And like the day before, I think because I had to take my exam in Austin. So I left my study materials in Houston. I was like, at this point, what I know is what I know, what I don't know is what I don't know. And I don't want to overwhelm my brain. I want to give it time to just sort of relax and just trust
Nice.
the process. So
Yeah.
I would say like that. And again, of course, each person is different, but I have been studying very diligently for like several months prior to, so that the day before I was like, you know what, I'm gonna leave my study materials in Houston. I'm not gonna even try to overstress or try to burn the midnight oil trying to cram information. I just wanted to give my
Right.
brain just time to just decompress so I could just focus on, taking the test, and just I use that time to just remind myself that I knew it, that I was capable of it, going over affirmations. That's how
Mhm.
I spent the day before. And I would encourage, you all to do the same if you're in that position.
Yeah, yeah, that's great advice. I love that, right? Just sort of recharge, refresh your mind. Because, I mean, it's not like you're going to learn it last minute anyway, right? Like if
Right.
you don't know it about the day before, it's probably
Right.
not going to stick. So focus on giving your brain a little relaxation, a little air. I love that.
Yeah.
Because it
Especially
is
because it's
stressful.
not because especially because the test is not content based anyway. So you going over these little facts is likely
Right.
not going to really do much anyway.
Yeah. Great point. Awesome. Well, so for those of you who are maybe currently in graduate school or already have the associate label, Aaliyah has shared some really valuable tips for you as far as finding sites that may align with who you are and your values and what you want for your training, how to find a supervisor who fits for you. And also for those of you who are still in that process of working to pass the exam, some useful tips as well. So hopefully you'll take advantage of those. So now we want to transition to some more application-based questions in a way and talk about some of the areas where you specialize. So, as a marriage and family therapist, you do a lot with relationships, right? And ideally healthy relationships. We're going to talk a little bit about healthy relationships, and how folks can identify those unhealthy relationships, right? Social media, there was the whole hashtag red flags going around
Yeah.
last year for a while. So we'll talk about a few red flags as well. Now, over this weekend, someone asked me, a friend of mine was introducing me, and she introduced me as a marriage and family therapist. And so the person asked, like, what's the best a single piece of advice that you would give couples? And I was like, oh, that's a very valuable question. So I'm going to pose that question to you, Aaliyah, to see
Okay.
if you could only give one piece of advice for creating a healthy relationship for a couple, what would that be? And then I'll share the advice that I gave the person this weekend.
Okay. Whew. Okay. Two things popped up, but I'm gonna just stick to one. So, um,
Go ahead and do both.
okay. So I have two. One is, I
Okay.
guess, for more like, I guess, more proactive and more is, I guess, maybe really reactive. But so I guess one is that I think it's really important for couples to continue going on date nights. I think that that is extremely important, especially as, you start to have children, or you maybe have jobs, or you have family issues, or whatever the case is. I think it's really important for couples to not neglect date night, and dates just our intentional time together,
Right.
because just I remember in grad school learning about Esther Perel, and one of the things that she was saying, I guess she's a very well-known relationship therapist, and researcher as well. And one of the things that she was saying is that nowadays, especially for married couples, they are going to experience multiple marriages, even though it's with the same person. And so it's really important that you're still getting to know your partner. You're still learning their nuances, learning things about them. Because if you get married at, let's say, 25, 27, and now you're 45, that the person that you were at 27 is not going to be the same person at 45. So
Not at all.
their favorite color might be different, what they like might be different, how they think is going to be different. And if you neglect date night, then that's how you can look up one day and just have a roommate as opposed to a spouse or a partner. So date night is really important, that intentional time to connect, prioritizing intimacy with your partner. That is very, very important. And then the other piece that I think is also important is to remember that it's never you versus your partner, but it's you two versus whatever problem you guys are facing. I think that having that perspective is really important, because sometimes there will be miscommunication. Sometimes there may be things happening below the surface, and it can be easy to think, oh, well, they're against me, or this person is, out to get me. But it's like, you guys are a team. And so so I guess sort of having like almost like that solution focused perspective, but let's externalize the problem. Let's think about it. Okay, how can we address the problem? And that could be whether it's a communication issue, whether it be a family, maybe somebody's mom is getting sick. So it's not just that person's mom. It's we're a team, and we're going to figure out how we can address the issue of someone being sick, or so whether it be a family issue, or it's a work problem, or whatever it is, being, trying to internalize the problem and think about it as, it's us two trying to address the issue, and not me versus my partner. So I think those are the two tips that I would encourage couples in order to be sustained.
Yes. Well, I'm glad you shared both of those, because both of those are very valuable, right? So, making sure that date nights are a priority and creating that intentional time together. And then remembering that it's you and your partner against the problem, right? Not
Yeah,
against each other. And definitely having that, making space for that intentional time together is going to help you to create that sense of teamwork and
right
camaraderie
together.
and, right, dependability with your partner as well. So it all works together for the benefit of the relationship, hopefully.
Right.
Well, so my tip that I shared with that person who asked me the question this weekend was that there's really no perfect relationship. And so a lot of times we'll kind of, set some somebody's relationship on a pedestal and be like, oh, our relationship needs to be exactly like this. When in fact, no, like your relationship should be your own. And so you and
Yeah.
your partner should come together, talk about your values, your goals, your aspirations, and what sort of relationship the two of you want to create. It doesn't have to look like anyone else's. It probably shouldn't look exactly like
Yeah.
anyone else's. It needs to be something that is meeting both of your needs together that you've talked about and
Yeah.
discussed and explored. And as you mentioned, that needs to be a continual process
Yeah.
because, right, that's going to shift as the two of you grow and your priorities change and your life
Yeah.
changes. So you've got to continue to shape that relationship based on what your needs are.
Right. Absolutely. And then
So that's my
one of,
tip.
one of the things that I was also hearing as you were talking is, so it can be very dangerous to put couples on pedestals and, have you know, these idealistic versions because you're not seeing the whole picture. You're only
Yeah.
seeing a piece, especially if it's with social media. That adds a whole other layer of not of
Yeah.
just not being truly what it is. But
Right.
but there it's you're only seeing the highlights. You don't really see the behind the scenes or the arguments that they may be having or the disagreements that they may be having or the other parts of it that are typically more private. You're not seeing that, and so it can be very
Right.
dangerous to idealize other couples because you don't know the full story. You don't know the full picture.
Right. You're not getting the full scope. And I would say even as therapists, we're typically not getting the full picture.
Yeah.
We get kind of the tip of the iceberg and what is it that the couple's willing to talk about when they come in
Yeah.
for counseling. But there's so much more that's possibly important that we're not given
Yeah.
access to even as therapists. And so would you agree with that?
Yes, I definitely would. I had a couple one time that I was seeing, and they never really addressed or they never really brought up one of the real issues. They just kind of stuck to the surface, and I think we were able to talk about some things, but one of the big issues in the relationship that the wife had an issue with is that her husband was watching pornography, and they never brought that up. They never talked about it, but that was a major issue that was hindering I guess the pornography was an issue because it was preventing him from wanting to be intimate with his wife. And so that was a big issue that was a part of their dynamic, but that issue never, they talked about everything else, but yet that wasn't, and it wasn't until one of the later sessions. And unfortunately, due to COVID, we had to stop seeing, like, they decided to not continue because of COVID and we weren't able to see them in person. But that was one of the big issues that was occurring in their relationship, but yet it was being hid by all these other aspects. And so I definitely think that
Yeah.
that there are often other things that may not be discussed or addressed, that are relevant to being able to achieve the outcomes that people likely want. So
Yeah. Yeah. Okay. Awesome. Well, kind of in a similar vein, then, what are some of the common issues that come up in the couples that you've worked with? Of course, without any specific client
right.
information or releasing anything private, but just what are some of the common topics or issues that couples are bringing in, and how might a couple know that they should probably consider counseling?
So some of the issues definitely that I've experienced, that I've seen is just like I mentioned, where like pornography is hindering intimacy, or at least that's the way that maybe one partner would articulate it, is that that could potentially be hindering intimacy, whether it be emotional or physical intimacy. Also infidelity, that's something
Mm,
that I've experienced. Um, so couples dealing with infidelity, couples dealing with disconnects as far as intimacy, again, whether that be emotional or whether it be physical. Um, and then communication issues, that is a very common presenting problem. So having arguments that are starting to go just from being maybe verbal to maybe things are getting physical, whether it be intimate partner violence. That's something that I've experienced. And then to your second piece of your question, I would say maybe if the issues are no longer being able to be resolved just between your partners, and where things are sort of maybe you're going long periods of time without communicating to your partner.
Mm,
So,
mhm.
or were there maybe shifts in certain patterns? You know, maybe there were certain things that you were able to be resolved, but now things are getting more extreme again. To where maybe you guys are not talking as frequently, or there's long periods of time where you aren't communicating. Maybe where things are starting to get violent, where there's more extreme instances of violence, where maybe you're throwing things, and it's becoming increasingly more violent, or so those are some of the things that I would say potentially. um, Maybe if there are other people that are observing behaviors or traits that are outside of your immediate circle.
Hmm.
So maybe disagreements are being able are going from just being at the home, and so now maybe they're spilling over into public environments, or like in family spaces, or with your friends, or again things. I guess there's a lack of self-regulation involved with some of those arguments, some of those disputes. I think that it could potentially mean that there are, or if there's threats of divorce happening, right? Or,
Oh, yeah.
maybe if that's like, there may be things that are being, oh, well, I'm going to divorce, but then maybe there's instances where that's being recanted. So where things starting to become, again, more extreme, or there's, the two of you are no longer able to adequately resolve certain issues, or resolve certain disagreements, or then that could potentially mean that there is, maybe it could be beneficial to have someone else sort of help to sort of manage those disagreements.
Yeah. Okay. Yeah, I would agree with all of those. I think definitely, noticing a pattern of conflict that you can't resolve is a really good sign that, hey, maybe we need to get things on track here with our relationship. Uh, I would say for me, maybe an easy way for folks to identify that counseling could be helpful to them is if you're not getting what you want, or you feel like there's something that's causing a block in you meeting your partner's needs. So if there's either person, if there's some needs that aren't being met, and you are having a hard time figuring out why that is, or how to do that, or what's going on. And a lot of times I think, in our society for women, um, we can sometimes be so self-sacrificing that we aren't always getting our needs met, and we don't always feel like we deserve to speak up when our needs aren't getting met, and we just kind of put up with it. And over time, right, that can lead to a very difficult, unhealthy cycle, bitterness and lack of intimacy and other problems. So really being honest with yourself about, are my needs getting met in the relationship? And then if you're at that place where you're like, but I don't really know what the needs are, I just feel like something's off, right?
Yeah,
Then definitely going to counseling may help with that. And sometimes going to individual therapy can be
yeah,
helpful initially, and then maybe considering couples work after that for
yeah.
some. So that would be my recommendation for a way that you can kind of tell when's a good time to go,
Yeah,
before you're at the point of,
right.
yeah, barking down each other's throats every day.
Yeah, absolutely.
So to that point, then let's talk about some of those, because you mentioned intimate partner violence and some red flags kind of related to that. This past week, I did facilitated a training for Trauma Support Services of North Texas on gender violence, particularly with transgender populations. But one of the things that I shared in that training was specific subcategories of violence, right? What are some examples of physical violence? What are some examples of sexual violence, or emotional and verbal abuse? Because I think, people have a picture sometimes of what abuse is,
Yeah,
and they may not always realize that what's happening within their relationship is abuse, right? And so a
yeah,
couple of the things that I shared was for example, with sexual abuse, right? Being forced to have sex, being forced to have sex acts recorded is essentially abuse. If you have a partner who's calling you names, um, or making you feel less than or uncomfortable in some sort of way, pinching, biting, like even those things are considered abusive unless those are things that you want to happen in
Right.
your relationship. So for you, what are some signs of an abusive relationship, or what are some intimate partner violence red flags?
So so at the core, at least, one of the things that, we sort of teach our clients at my particular site is that abuse is really about power and control. So that it's a pattern of behavior, right, where one person is trying to exert control over another person. And so one of the things that I think is also important is for us to listen to that internal um, I guess, dialogue, listen to our internal, how we feel. And if there are instances where you feel as though, you may possibly be controlled, or you may possibly be, not able to have autonomy to do the things that you want to do, that could potentially be an indication that maybe something is not right. Um, we typically think of abuse as being just physical. And even our definition of physical abuse is a little bit, could still be a little bit narrowed. And the reason why I say that is because we typically think of physical abuse as being someone making physical contact with your body. However,
Right.
physical abuse is spans larger than that. Some instances of physical abuse where someone may not be making contact with your body is threatening you with a weapon. So they may not necessarily pull the trigger, but if they're, um, maybe pulling out a gun and maybe putting it on the table as you're arguing, they didn't necessarily make contact with your body, but
Right.
that's a very clear sign that if you don't do what I say, I'm going to harm you, I'm going to hurt you.
Right. Or
Someone
even making reference to a weapon that they have, right?
right, or I'm gonna kill you, or I'm gonna hurt you, those kinds of things, those are definitely forms of abuse. Also punching a hole in the wall or throwing things, again, even if they didn't throw it at you, those are very clear tactics trying to instill fear in another person with the intent of trying to control, trying to manipulate, trying
Yeah.
to um,
Intimidate.
right, intimidate. And those are also forms of physical abuse that, again, are not contact, like the person is not touching your physical body, but those are very those are instances where that are abuse that would fall under the physical abuse. Or even, let's say, you're trying to flee a situation, that person blocking a barricade or blocking an exit or standing
Yeah.
behind your car as you're trying to leave, that is also a form of physical abuse that is not involve someone making contact with your physical body. So those are definitely
Yeah.
red flags, but even precursors to that are those I'm sorry, psychological and emotional, verbal
Yeah.
abuse. And the dangerous things about those things is that they're very subtle. So it can be easy to overlook those things or to not consider those to be abuse. But
Right.
the truth is that if someone is doing multiple instances of verbal and psychological abuse, research tells us that things are likely to escalate into being more overt forms of abuse, which are, like those sexual and like physical instances of violence. And some examples of those are, isolating you, not allowing you to spend time with your friends, not allowing you to spend time with your family, or if they do allow you, and I put that in quotes because
Mhm.
you're an adult, so someone shouldn't be restricting in a healthy relationship, someone is not restricting your ability to leave your home, but calling
Right.
you, blowing up your phone to the point where you just decide, okay, this is too much of a hassle for me to be away, so I'm just not going to go at all. Those are, again, those subtle instances that are seeds of isolation that can become very, very can that can manifest into more extreme forms of abuse or more extreme forms of violence. Someone, habitually cheating on you is also considered to be instances of psychological abuse as well. Forcing you to do something that's illegal,
Right.
using your children against you. So saying things like, "Oh, well, if you leave me, I'm going to take the kids," or
Right.
even sometimes threatening to harm themselves, saying, "Oh, well, if you leave me, I'll kill myself," or "If you leave me, I just can't live without you. I'll hurt myself." Those are also very manipulative forms of emotional and psychological abuse, and because that person knows that you don't want them to hurt themselves. You don't want to be without your children. So they know that if they say those things, it'll force you, or you'll make the decision, even if they're not physically restraining you by forcing you, you'll make the decision to stay with that person because you don't want them to hurt themselves, or you don't want your children to be hurt. Those are all forms of abuse, and those are forms of manipulation. And so those are some of those things that can be very subtle and can maybe happen like at the beginning of the relationship. And so once those, in the cycle of abuse, right? Once those more subtle forms of abuse happen, then likely, again, they can exacerbate into being more extreme forms, or even financial abuse. That's another form of abuse that people don't often really think of as abuse,
Right.
but that includes you wanting your name to be on the house or the car, or certain things that you guys have shared together, but their partner won't put your name on there. Or either, withholding child support. That's also a form of financial abuse, forcing you to relinquish your paycheck or relinquish money that's rightfully yours, without any access to it. Or either causing issues at your job to the point where it's jeopardizing your job security, or saying things like, "Oh, you don't need to job," or forcing you to quit your job,
Right.
again, but without giving you proper access to additional financial resources. So those are all forms of financial abuse. And that's another thing, again, that people don't often think of as abuse, but it really and truly is, because in a healthy relationship, those decisions are discussed upon with both partners, and you're able to kind of come to a mutual decision. And that is regardless to how much you are necessarily contributing. So even if you're a stay-at-home mom, that doesn't mean that you don't have the right, or you don't have the right to have access to the financial resources as well. So
Right.
again, in a healthy relationship, those decisions are mutually agreed upon, and it's something that's discussed. Even making big purchases, right, or taking money out of a bank account, that those in a healthy relationship, those are things that are discussed upon with both parties, and you are able to kind of come to a decision or come to an agreement that both parties are happy with. But
Yeah.
one person taking control of that, and or even using gender roles, saying that, "Oh, I'm the
Mm.
man, so I get to do this," or "You're the
Right.
woman, so you're just supposed to do X, Y, and Z." Those are forms of manipulation, especially, if religious texts or religious doctrine are used and sort of manipulated. That's a form of spiritual abuse, which is something that people don't talk about either, or maybe not aware of. But
Right.
using certain spiritual doctrine to manipulate or to flip, to take things out of context, those are also forms of abuse as well.
Yeah. Well, I really appreciate you going through all of those different types of, right, of abuse and violence, because definitely I think many folks don't realize how broad, right, that definition is, and the different types of behaviors that can fall under that umbrella
Of
of
abuse.
intimate partner violence.
Yeah.
Essentially, right, a healthy relationship, the foundation of a healthy relationship is respect. And
Yeah.
usually when you have a relationship where there is this pattern of abuse and violence, the respect either has disappeared, dwindled, or maybe it was never even there.
Yeah, to begin with.
Yeah. And so I think for a lot of people, yeah, they have this idea in their head that abuse must be forceful. And if their partner isn't forceful, then it's probably not abuse. And that's just not the case, right? So I'm glad you talked
Yeah.
about financial abuse. I'm glad you talked about spiritual abuse, sexual abuse, because what we find is that perpetrators of intimate partner violence, particularly when we talk about psychological and emotional abuse, right? There are these attempts to cause their partner to be dependent on them in some way.
Yeah.
And they are pretty good at knowing what they can do to manipulate their partner,
Yeah.
right? They know what those areas are that are going to get their partner to do what they want, whether it's
Yeah.
I'm going to use the kids as a pawn, or I'm going to use money as a pawn,
Yeah.
or whatever it may be for that particular person in their relationship. They get really good
Yeah.
at manipulation, right? So I'll definitely make sure that we put some resources with this episode, some resources in the comments or the description for folks who may feel like they are in a
Yeah.
relationship that is abusive or violent in some way. So thank you for all of those. Any other tips then for either creating healthy relationships, identifying red flags, taking advantage of relationship counseling? Any other recommendations or tips that you have for listeners?
Let me see. Let me see. I guess one of the things that I guess like final words, if you will, I think sometimes, yeah, I guess to your point that you were talking about earlier, you were saying that sometimes, as women, we have a tendency to maybe be okay with, or to maybe not think that it's okay for us to want certain things, especially in a relationship, or to um, I forgot the word that you used, but it was really great. But essentially, this idea that we have to accept the bare minimum, or we have to
Mm,
maybe accept less than what
self-sacrificing,
we.
I think
There
is
we
what I
go,
said.
self-sacrificing. That's such a great word. Um, but I just want to encourage, to any person that may be listening, that the kind of relationship, if you can envision it in your mind, if you can envision something where there's love, there's respect, there's reciprocity, all of the things, if you can close your eyes and you can envision it, then that is something that is possible for you to be able to experience, and you deserve to have that sort of relationship. And that's something that I often tell my clients, who are survivors of domestic violence, that, even if you never saw that relationship with your parents, you grew up in a home that was nothing like the relationship that you desire, that it's okay for you to desire that. It's okay for you to want that, and you're
Yeah,
deserving of that. You're deserving of a partner that cares for you genuinely. You're deserving of a partner that gives to you what you give to them, even if it's not the exact thing, but the magnitude of what you give. You're deserving of a person that can provide to you the same magnitude, and you're deserving of that. You're worthy of that, and you're not asking for too much just because you want a partner that can give you those things. And so I just want to encourage anyone that, who may be struggling to, maybe the relationship that you're in, you're not really sure if it's a healthy one, you're not really sure if it's great, but you know that internally you just don't feel at peace, you don't feel whole, you don't
mm,
feel loved, you don't feel accepted, you don't feel seen, that it is possible for you to experience a relationship where you have all of those things. And again, you're
yeah,
not asking for too much, because you want to feel heard, because you want to feel seen, because you want to feel validated. You want a partner that will show up for you in the same way that you show up for your partner, that you're not asking for too much, and you are absolutely deserving of that.
exactly. Right. Regardless of what your past may include,
Yeah.
regardless of, right, nobody's perfect, regardless of all of that, each and every one of you deserves a healthy relationship and to be valued in your relationship, right?
Absolutely.
And so, as you were talking, it made me think about one piece that I uh, sort of left off, hadn't thought about until we got to this point, that I think it's important to say, since we are talking about intimate partner violence, and that is, we cannot force a person to leave a
Yeah.
relationship, no matter how abusive we think that relationship is. Research shows us that uh, women are more likely to lose their life and to be victims of homicide
Yeah.
after they attempt to leave a
Yeah.
relationship. And so, one of the things that therapists, marriage and family therapists, social workers, whatever your certification is or license is, in working with folks who are subject to intimate partner violence, it's about creating a safety plan, right? So
Yeah.
identifying a good time to leave, but also resources, support, protection. There are many things that have to be in place before
Yeah.
a person leaves an abusive relationship. It's not like, well, I'm just going to move and change my lease, right? It's
Right.
not that simple. And so, um, there are a lot of life issues as well that can play a role in a person staying with someone who is
Right.
abusive, right? If they are financially dependent on that person, if
They
there are
have
kids
children.
involved,
Yeah.
right? And I was telling a young lady the other day who's recently been a victim of intimate partner violence. There's also brain mechanisms involved, right? That
Yeah.
the reward center of our brain is continually telling us that, hey, give them another chance because
Right.
this is going to be the time where you're going to get the validation
Right.
you've been wanting. This is when he or she is going to do what you want them to do. This is, that was the last time that this is going to happen. And so we so want to believe, right, that that pattern is going to shift and that the abuse will
Yeah.
end and that they'll be the perfect person that we've been envisioning all this time. And so, unfortunately, our brain's reward centers sort of play that trick on us
Yeah.
and really want us to believe that that person is going to do better. And sometimes they do, but often it takes work on their part as well as
Right.
work on the client's part for that to happen.
Yeah.
And so, with that in mind, do you have any other tips or recommendations, for example, when you work with folks who have been in an abusive relationship? Um, because people often hear that, well, why don't you just leave?
Yeah.
Are there any other things that you tend to talk about or recommendations that you give when working with populations that have been in abusive relationships?
Yeah, so I definitely think, it's important for people to know that it can be very stigmatizing for someone to be in a situation where there's domestic violence and to hear, oh, well, why don't you just leave? Or, things like that, or even to the degree of blaming them for their abuse, right? That is a very difficult thing for someone. Like that's really hard for someone to hear that's in that situation, because regardless of whether a person might have ignored red flags, regardless of, if someone might have, gotten in a relationship with an abuser, the abuse is never their fault. There
Right,
is nothing that a person can do that can warrant them deserving to be abused. That's just not the case. And so to say that, oh, it's your fault that you're getting abused is just simply not true. And it pushes them into a place that causes them to feel more shame, to feel more guilt, and it makes it that much more harder for them to be able to get out of the situation.
right,
Um, so that is definitely one thing, but when it's really important to have empathy and to, be a support, ask that person, how can I best support you in your situation, or what is it that you most need? And really being mindful of those other nuances that make it difficult to escape. You mentioned finances. Again, if you don't have credit, if you don't have renter's credit, if you don't have, any type of financial resources, then it makes it difficult for you to get a place to stay.
right,
Because again, if you don't have renter's credit, then it makes it difficult for renters to want to lease a place out to you. Or again, if your name has never been on any bill, if your name has never been on any a house or a car or any of those things, and it's difficult, like you don't have credit.
right,
So again, it makes it challenging. Or if you have children, having to have those conversations with your children about why mommy and daddy, are not together anymore. Or even, you know, children see things differently, they understand things differently. And so being sensitive, that is important. Or if that person is an immigrant, there could be language barriers, there could
mhm,
be other nuances that make it challenging and that
yeah.
make it difficult for someone to,
Citizenship concerns,
right,
right?
citizenship.
Yeah,
And oftentimes, people have a threat of, oh, I could be deported, or, things like that. And so it's just important for you to be very sensitive to someone who may be in that situation, but, encouraging them of what their value is, what their worth is, or, things like that could be beneficial. But again, just being supportive to what their needs are, finding out what their needs are and helping them to have resources, maybe giving them information to shelters for in the event if they would like to escape. What are some, again, back to that safety planning piece, what are some things that could potentially be helpful? And maybe giving them resources to hotline numbers. That way, again, if they decide that they want to leave at a last moment, places that can help walk them through what that safety planning may look like, or what are some things that they may need to keep on handy, like birth certificates or copies of, important documents, having maybe a bag, but again, you have to be careful about that too, because you don't want to place them in a situation that could be unsafe. And so again, it's just really important for you to be sensitive to someone. If you know someone, give them empathy, give them support, let them know that if they need anything, that you're a resource that can be available for them in the event that they may need to flee and they may need a place, or, just various things. But just being sensitive to that, trying to be careful not to stigmatize them or to push them further into a place where they feel more isolated than they already do, because they often, dealing with guilt and shame is a very common experience for a domestic violence survivor, because they're, aside from what people are saying, they already internally are like, well, how did I get in this position? Or why did I get with this person? Or why did I have a child with this person? They're already dealing with that internal dialogue, that it's not helpful to have other people around them
adding to that,
adding to that already exacerbated feelings of guilt and shame. So providing empathy, providing support, asking them what their needs are, and again, not trying to force down their throat that they need to leave, or that, because there's also that emotional connection as well that makes it difficult for them to leave their partner. So it's a lot of barriers, it's a lot of factors to consider, and it's not easy. You mentioned about, the risk of homicide goes up. That's what research tells us, that it's on average, it takes someone 7 times before they're successfully able to leave their partner. And so it's very important to be careful when those situations, and just to provide support. And again, ask that person what it is that they're needing, because they'll be able to tell you. And if they don't feel comfortable enough to tell you, by you showing them empathy, then maybe eventually they will be. So those are just some of the things that I would share, and the things that I utilize whenever I'm interacting with my clients.
Yeah, I totally agree with all that. Like, even just that show of care and empathy can be so important. It may not shift anything that day necessarily as far as behavior, but what it may shift is that those emotions that they've been feeling, and it may have an impact on mindset, which mindset has to shift before
You're physically
physically decides to remove themselves. And so it is a journey, it is work, right? And so if we, as family members, as friends, as colleagues, as supporters, can stay away from judgment and blame as much as possible when it comes to intimate partner violence, then we can do more to support and help those who are in those relationships. And to your previous point, I would just say that I concur with that no one deserves to be abused. It doesn't matter if you bought the wrong type of milk, or you spilled food on someone, or if you said something inappropriate, or whatever it was that you think that you did, that does not deserve, right? That does not lead to you deserving to be abused in any way. Yes. So we'll include some resources in the information for this episode. Again, if there's anyone out there who feels like some of this sounds familiar, and you may think that you are in a relationship that is abusive, or that includes some sort of intimate partner violence, so we hope that you will reach out to get assistance for some of those resources. So to close us out in our last minute or so, who is Aaliyah when she's not at work, right? We've talked about you as a clinician and the work that you're doing as a supervisee and all of those things, as an LMFT associate. But you don't work 24/7. Sometimes it may feel that way, I know. So for listeners who are saying, okay, well, but who are you, right? When you are out of the office or whatever the case may be, give us some things that help us to get to know Aaliyah the person.
Okay. So outside of work, I definitely enjoy being a mental health advocate. That's kind of like work, but a little bit different. Doing things like this, so opportunities that I may get, different speaking engagements to speak to different people. That's something that I'm really passionate about. Mental health education is very, very important to me, especially to communities of color. So I enjoy that. I think it's really important to help African American people to be aware about mental health, to educate them, especially because sometimes certain things may present themselves differently within our community. So it's important just to educate people, make them be aware, of the importance of mental and emotional wellness, and sort of dispel the myth that what happens at home stays at the home. So being able to kind of talk about different things, that's really important to me. Um, but I also love to travel. I really enjoy traveling. I really enjoy going to concerts. I've been to, I think, 4 concerts this year
Oh,
alone.
wow.
So I went to see Music Soul Child. I've seen Jasmine Sullivan. I went to see Eric Bellinger. I feel like there's somebody else, but it's escaping me at the moment. But I love going to concerts. That's one of my
Okay.
favorite things to
You
do.
haven't been to a Joe concert this year? I went to see Joe in
I
concert.
did. That's who it was. It was Joe, Anthony Hamilton, and Maxwell. I knew it
Okay.
was gonna
I
be one of
went to
them.
that one. Yeah.
It was
Yeah.
it was in there. So yeah, I went to see them as well earlier in the year. I think that was in March. The other ones I think were in April. So, but I went to see Lucky Day, or not Lucky Day. Oh, he has the deep voice. Giving On. I went to see him last year. So I love going to concerts. That's like one of my favorite things to do. Traveling, one of my favorite things to do. I think I'm in the process of planning some trips, maybe going to Orlando with some of my line sisters actually for our boule in Orlando in July. Might be going to Chicago next month. So we'll kind of see. Love traveling. I went
Okay.
to Galveston, had a solo trip a little bit earlier in the year. So I enjoy
Okay.
traveling.
Solo travel. Nice.
Yes.
And you mentioned your sorority sister. So which sorority are you representing?
Alpha Kappa Alpha Sorority Incorporated.
Okay.
That is something that I have been enjoying, spending time with my line sisters, getting to bond, getting to spend time with them. Hats with the pink shirt, to show out a little bit. But
Right.
so yes, I enjoy spending time with my line sisters. I also enjoy, I have other friends that are not Greek that I enjoy spending time with as well. We're all over the place, different life experiences, but it's always nice to be able to spend time with them, get some girl time. I went to college with a few of them, so kind of nostalgic, getting to kind of reflect on our college days, but just getting to kind of catch up with life and where things are now. I'm also really involved in my church. I'm on our praise team. So that's something that I'm also involved in. So just kind of like to be well-rounded.
Yeah.
Um, so yeah, my favorite drink is a pina colada. So I enjoy occasional
Oh,
happy
okay.
hour after work as well. Got a good self-care, right? Got to stay balanced. So
Yes. Balance is important.
definitely, definitely, definitely.
Awesome. Well, then, this has been a very enjoyable conversation. We've touched on several topics. It's obvious that you are very knowledgeable, that you're a caring therapist. It's one of the reasons why, no, just one of many, why I think we've had a very valuable supervisor supervisee relationship. That it's
Absolutely.
clear that you care about your clients, that you want the best for them in their lives, and that you're willing to do the work to be a better therapist for them, right? If there's something you don't know, you'll figure it out. You'll ask for help or feedback to get that support that you need. And that's, I think, very important when it comes to effective clinical work, right? Effective counseling. So I hope our listeners have enjoyed getting to know you a little bit, learning a little bit about marriage and family therapy, about intimate partner violence, red flags, So just in case there is something that someone wanted to know that we didn't take time to discuss during the episode today, how can people reach you? How can they follow you? How can they find out more about the mental health advocacy that you're engaged with? Share your handles, your contact info, whatever you're comfortable sharing with the audience.
Okay. So I guess one other thing I didn't mention is whenever I'm not working, I also have a mental health blog as well that I do post, and I, share different things about myself as well as, different mental health topics as well. And so the website for that is www.sophisticatedlyme.com. That's also my same handle on Instagram. On Instagram, I'll post, different mental health videos as well. Also post different inspiration, different things throughout my faith walk, being a Christian. And so that's sort of what my Instagram looks like. And so I'll share different things. My handle for that is sophisticatedly_me. That's my Instagram. And then I'm also on LinkedIn as well. And that's just my first and last name. So Aaliyah Mara, AALIYAHMAURA on LinkedIn. And then I believe that that's it. That's all I have for social media and connectivity. So. Oh, also, I can also provide my email address in case anyone would like to get in contact with me for any future, opportunities. So,
Speaking opportunities, right?
yes. So aaliyahmara@gmail.com. It's just my first and last name, really simple. Again, first aaliyahmara@gmail.com. So try to keep it pretty consistent across the handles. So, but that's
awesome. Well, this has been very enlightening and engaging. I thank you for jumping off our season 3 for the I Can't podcast, for giving folks some useful, valuable information on healthy relationships, intimate partner violence, reasons to go to counseling, all of those, and as well as helping other prospective or current associates with tips on finding sites that are a good fit, finding supervisors that are a good fit, and even prepping for that oh so stressful exam. So again, we've covered a lot. Hopefully folks will take the time to listen. You might need to listen to this episode more than once to make sure you get all the tips and all the gems, right? Every little piece that was shared. So we thank you for sharing with us today. We thank you all for listening and joining us for our first episode of season 3 of the I Can't podcast. We look forward to connecting with you soon on our next episode. So we will hear or see you all very, very soon. Until then, make it a great day. This is Dr. Chi signing off. And feel free to say bye, Aaliyah.
Okay. Bye. It was definitely a pleasure. I hope that something that you hear, it resonates with, or something that you see if you're watching it. But I hope that it's my prayer that something that you see or hear, that it will resonate with you, that you will be informed, you will be educated, and that you will walk away a little bit of a better person. So bye-bye.
I love it. Bye, y'all. See you soon.